we have titled this as Mental Health in COVID Times. For those of you that are joining us on Facebook Live, thank you so much for being part of this conversation. If you want to invite others to join us, please feel free, share the link. We are not confined as in regular conferences to a meeting room which has finite capacity of seats. This is infinitely scalable. I just start with a list and introduce each of them. Dr. Sameer Parekh, Dr. Pankaj Gupta, Professor Gangadhar, Dr. Prakriti Poddar, Dr. Sanjay Chugh, Dr. Nimesh Desai, Dr. Solanki from Jaipur, Dr. Indla Reddy, Dr. Rajiv Mehta, Dr.Sameer Malhotra, Dr. K Deuri. We have only one lady here on this panel. We need to make sure that we have an equal number here. Dr. Roma, thank you so much for joining us. And therefore, gentlemen, I will kind of change the odd thing, and I will sometimes preferentially go to Dr. Roma and to Dr. Prakriti when the conversation kind of turns around. And I hope that is okay by you. And at ISW, we firmly believe that the world is equally held by men and women. And so therefore, the world of opinions also and expertise also should be equally distributed. Thank you so much. Let's start. And I want to kind of basically understand the kind of context that we are in today. Everybody talks about lockdown. For many people, it seems to be that you are confined behind locked doors. People are saying, don't get out. If you get out, neighbors are taking snapshots of yours and putting it out there and saying, hey, look, that's a criminal kind of a thing. What is it that we mean when we say that we are in a lockdown? Some people use the word quarantine. Others kind of think of it as a prison. So I just want to kind of, at a broad level, understand what it means and how it affects individual well-being. The words confinement, lockdown, and quarantine. May I start, because I know on the time start, with both Dr. Roma and with Dr. Sameer. Between the two of you, if you can just pick it up for us and help define and set the stage so that we can get the conversation going.
Now, about the basic question of lockdown, confinement, quarantine, it occurs to me that 2 points are worth considering. One is lockdown is a decision by the system, the state or the nation. And so the system is in lockdown. The effect of that on individuals and groups and families is of being confined. So the confinement is the effect on the individuals or families or groups. Quarantine is, as Roma was saying, obviously a medical caution, which involves confinement. In a lighter vein and yet seriously, most of us around this panel who hospitalize patients, whatever sector we work in, we are perhaps getting the first experience of being confined. As we all know, admission to mental health facilities, ethically, legally, in human rights perspective, has often been seen as confinement. And while some of us have recognized that with empathy, maybe clinicians are possibly getting the first-hand experience of confinement. I would also say that most of us clinicians and mental health and health professionals are actually getting away with it because we are getting to go to work. Whereas our general population, the few hundred people who are with us on the show, will realize that, and I keep thinking about this to myself every night and day. If one had to be actually confined to one's apartment, and it had been 10 days, it would have been so much more difficult. So while we say that we are performing duties and we are stepping out at race and we deserve all the credit, it's also true that most of us around this discussion wouldn't really know the experience of full confinement. I don't know if anyone here does that.
Dr. Desai, thank you so much for unpacking my question, because that's the reason why I put it there. I started my life in an institution for women and children where I was a medical doctor. And so therefore, part of the thing was to understand what people felt when they were told that they were being institutionalized or they were being sent to the hospital. And so therefore, in many ways, using those three words was not merely academic because they have weight in the community level for people. And many times we have notions of rightful confinement. It could be criminal. And so therefore we send people to jails. Or we could say your health demands that you be confined to a hospital or to a room, which is another thing. Or there could be wrongful confinement, which leads to senses of angst and also rebellion. Why am I being held against my will? And so therefore, in this context, that's the reason why I wanted to start with that broadest of outlays, that we are here, everybody's talking lockdown. Sure, the system has said that we need to slow some things down because there's an epidemic out there. It is tantamount to quarantine, but to most people, it is feeling like a lockdown or a confinement against their will. I come back to Dr. Reddy. Dr. Indla Reddy.
You see, the main difference I feel between lockdown and confinement, in confinement both the things, the physical distancing is there, but in lockdown, emotional closeness is there. Still in lockdown, we are able to connect to others, our own people, friends, relatives, and you can make video calls, phone calls, we can do our banking, we can do some telemedicine consultation. So all these things can be done in lockdown, but you cannot do all these things in confinement or quarantine. So there is a physical distancing, but emotional connectedness is there in lockdown. So we are fully at freedom, liberty, but from our own place. So I feel this is the main difference. So psychological and emotional connectedness is there. Only physical distancing is not there. Distance is there. Whereas in other things, no, your freedom is totally curtailed. So I think this is the main difference between these two things.
May I take Professor Gangadhar and then Dr. Deuri?
Indla has made a good point. We need to realize that confinement, from the way Bobby defined, is not a confinement. This is a feeling that if they get it, I think it is wrong. There are a lot of activities are still allowed. People can reach out to everyone. You can even come out of the house, use your garden, do some work in the garden. Those who are having a farmhouses can do everything else outside. Make sure that you don't come into physical contact with the people. And this is imposed necessary because we don't want the public, we don't want it to become a community spread activity. So if people can present this thing, whatever they are suffering is for the betterment of the community, probably there will be a difference in the way in which they're going to look at it.
Right. Thank you, sir. Dr. Deuri. You're on mute. Oh, yeah.
Here, it's basically the difference is in implication. Quarantine has a medical implication. That's all. For a particular purpose, somebody is kept in a different way, is quarantine. Lockdown is the implication of law and order. The physicality of lockdown will be defined by the state. How far, how much. That is basically by the state. Now, coming back to confinement is curtailment. The implication is you are curtailing somebody's liberties, freedom, and things like that. It may be because of different reasons. Maybe because of medical reason, maybe because of law and order, maybe because of some other purpose. So these three, the difference is basically an implication. Sure. Otherwise, more or less, it means you are segregated, you are separated, and you have to abide by some rules. These rules may be state-made legal, it may be ethical, it may be moral, it may be emotional, it may be social, whatever. Thank you.
Thank you so much, Dr. Deuri. I just want to kind of, there was a little bit of work that my team did, and we were looking at the number of people or the proportion of population that lived in one-room settings or maximum two-room settings. And when I kind of look at that, the idea that we have space outside where we can either go to our garden or to our balcony kind of goes a little bit against that number that is there, which is very, very large. So if I were to look at, say, a Dami, or if I were to look at inner slums or even a village cores, people come out. Yes, if they are in the agricultural activity, they are able to go out. Otherwise, they are in limited spaces. And I'm mindful of Dr. Sameer Parekh's time. And so therefore, when people feel that they're, let's put it this way, confined against their will, what is it that we can do, or how is it that we can help them cope? And I know that your time is the one that is shortest on this. So therefore, let me ask you that question, Dr. Sameer Parekh.
See, I think it's about the messaging. It's about the message reaching into the right people in the right manner with its positivity that instills a sense of social responsibility. If we can have over a few million people light candles, switch off their lights at 9 p.m., we can also make sure that the message of why we are doing and what we are doing reaches. I have been doing lots of video consultations. Um, I have been doing a lot of webinars. To be honest, I am consistently meeting people, coming across people who are more than happy to take part in what their social responsibility is. What happens in today's world is we end up magnifying our negative experiences and some acts of some people which clearly are not logical or, let's say, stupid enough. But the fact is, we need to appreciate that a large part of our population is very much cognizant of what they are doing, aware about it, understand there are hardship implications, but are very much able to do their due primarily because of the messaging. And I think that messaging, the social psych component of mass communication, is something where all of our roles is there. What you are doing today via digital medium, reaching out to a few hundred people, and similar colleagues, I mean, all colleagues here have been reaching out in their own way to so many people. If role models, medical experts, government agencies, media, at the ground level, RWA, panchayat leaders, Anganwadi leaders, if everybody takes the message, it's my firm belief that, and you may call me the optimist, but the fact is, people do comply. And we need to believe, and I've always believed in Carl Rogers, that all people are essentially good people. So you start with that, feed onto that, and let the positivity take over. That's the only way to look at it.
Dr. Parekh, thank you so much for that vote of confidence on our collective positivity. And I think that's something that we can build on. I see Dr. Desai's hand first before I kind of move to the others. Sir.
What you brought out, Bobby, is a crucial element, the class differential. However much we may want to be thinking classless and egalitarian, there is a huge class differential about the confinement. Except for possibly 5 or 10 or at best 15% of the people who will have liberties outside the room or two rooms, as you mentioned. So that's one thing that we really need to keep in mind when we get the positive message across that Sameer is talking about. I am with Sameer completely that I think that to a great extent, we as a society and government and a nation are succeeding. We need to perhaps keep doing more as to how do people see confinement as one's own need for my own health and responsibility to the society rather than it being imposed. Like traffic rules and many other rules, can we internalize the impositions that have been made in the larger cause? But I'll come back for a minute again to the class differentials. And home-based quarantine, as we keep talking about for those who have had exposure, is very difficult in most classes. Because when you say that if you have been exposed, go home and do home-based quarantine, I think most people miss the point that that person goes home. There are 3 or 4 people in a 2-bedroom or 1-room apartment. And so, which is where the need for the quarantine facilities is much more in addition to all the positive messages that Sameer is talking about.
Absolutely. And because we have got multiple same first name people here, I'm going to kind of move to the other Dr. Sameer because we have got 2 Dr. Sameers here. So, Dr. If I can kind of just switch from there and build up on it. We've had a little bit of a conversation on the differences between what we may have, and we may not have perfect sync on what the gradation between confinement, lockdown, and let's put it this way, quarantine will be. But what it essentially also means is that you have reduced external engagements. For most people, meaning is stepping out and being part of something that they otherwise will not be at home. How does one begin to help a large number of people who suddenly see themselves curtailed of external interactions? How do you help people cope? And I'll come back to you, Prakriti. I see your hand.
I think you've raised a very valid question here. First of all, I must congratulate the entire team to bring in so many heads together. And the first thing which comes to my mind is when you're talking about this confinement or quarantine or isolation, there are 2 ways of looking at it. And a lot depends upon the perspective that we choose to look at. When we are talking about isolating a person, or a person is self-imposing this isolation, there's a difference. The person needs to understand the need for it, the responsibility towards oneself and the responsibility towards the society. So there are two tenets to it. One is responsibility towards yourself, the other is responsibility towards the other person. If this particular thought is clearly instilled through various methodologies, perhaps through the media, which perhaps is also happening alongside, that it is for your own good, for the good of your own family members, to save your own life, I think that message has to be very clearly cut across the population, across the strata, irrespective of the particular socioeconomic strata the person may belong to. The second thing which comes to my mind with regards to confinement and isolation is, we are all the time saying, do not touch this, do not do this, do not do this, that, and the other. The brain is trained into do's. It's not trained into do nots. So if we also emphasize the role of what a person could do, I think that little control in a situation where people feel that we are seeing the most developed world losing control at times, we are seeing many difficult issues coming up across the globe. At that point of time, that little doable aspect is something which is going to give that little control despite being confined. So whether it is engaging in hobbies which are constructive, whether it is completing one's pending work which was lying undone, whether it is bonding with one's family, whether it is self-help, whether it is clearing the mess around, there are so many things that a person could engage in. And the more productive a person gets into, the more doable options the person gets. The confinement does not look that negative and that pessimistic as a view. It becomes less suffocating to me. Sure. Coming to your initial question on quarantine, lockdown, confinement.
I think, but I want to kind of switch to Dr. Rajiv Mehta. I mean, just as building on, I mean, again, how do we help? I mean, what's the way that we can help people cope with reduced interactions? They don't have any place to go. Sometimes there may be a sense that you're held behind. What is it that we can do? Both, I mean, and let's be mindful what Dr. Desai had said, that there are class differentials in the way people will be able to take a prescription that we're giving.
As everybody said, that there is a class difference and there is a confinement. Now, what we have to do is how to use this time positively. There are many things which can be done. And like Dr. Sameer said, the uncluttering of mind and uncluttering of home, it is the first thing to do. The second thing is to improve the relationship. What we see that there is a thing called familiarity breeds contempt. When the people come near to each other, they start looking the faults of each other. They wish to turn the other people according to their own way. And when they're around 24 hours 7, then it is more so. So picking up faults, directiveness, ideas, they keep on increasing. So it is better to mend the mind of communication to improve your relationship. That is the first thing which a person can do, because human is a social animal and the society is important for the humans. So better to improve that communication during this time, number one. Number two, unclutter the home, and that way you can be productive. You can direct yourself to your hobbies also and be productive so that you can help yourself. Once you help yourself, you are helping the society also.
Let me kind of then move this, because it looks like the professors and the heads of departments are all saying that this is time where you unclutter, where you kind of look at what you can do within yourself.
Yes, uncluttering
with no disrespect to everybody who's a medical practitioner who's on the other side of a table. How does that prescription get bought or filled? And I want to kind of turn to both Prakriti and to Dr. Roma. I mean, because it's one thing to say this is what needs to be done. How do we kind of walk that line? And Prakriti, I mean, you've been in the community, or you're trying to help people with your own mental health outreach activities. How does that prescription translate? How does that get filled?
So, I mean, thank you so much for asking me this question. It's brilliant to be here. And just to give you a little bit of background, we started this Wellbeing Volunteers United, which is over 500 volunteers who've come together to attend a helpline to cope with basic distress that people are facing. It's a free of cost helpline. And what happens is we actually receive calls over very specific circumstances that people are going through. And definitely the classes, and if you're talking about the stratas of society, they're all engaging in very different sort of attributes where they're dealing with stress based on different parameters, if you want to call it that. One of the things we teach our volunteers is not to be prescriptive about what they can do in terms of a hobby or anything to do with that, because like in the training programs, we've had people say, oh yeah, you can, look out of your window and start painting. And that's silly, because not everybody has a window. Forget having money to buy paints, or like even having the space to be able to create that. Decluttering and sort of removing the clutter from your house. I mean, we're assuming again that people have homes and that they can do that, or they have space. We're assuming there's, I work with a lot of people in the suburbs of Punjab as well, in terms of Chandigarh UT district. And there are 8 families living in one home. I mean, 8 families living in one room. There's a lot of incest. There's a lot of disharmony. It's graver, the problems that we're talking about, than what we're talking about here in terms of this is entitled. This is people who can access you guys, who can call you and have access to doctors such as yourself.
May I switch to Dr. Roma? I mean, if you can just kind of pick up from where she kind of was dropping off.
Prakriti was very, very right in what she was saying. We are reaching out to, people are reaching out to us. Very few people are able to reach out to us. And think of that community where they are, they can't reach out to anyone at all. And also, when we say that you can do so many other things, but let's also understand, prior to this situation, everybody was only looking at pleasure and fun outside the home. So it was all external. Very few of us were only thinking of getting fun and some pleasure internally. So we will take some time to understand what it means to connect with yourself and navigate yourself towards different situations.
Yeah. So which is where I want to kind of bring in Professor Solanki. Prakriti was just saying that when people are very, very close together, there are certain aspects of people's behavior that get expressed even more than what we thought they had. And sometimes it might be in terms of abusive behavior to your spouse, children. You're kind of all the time there. How would you begin to enable people to engage with the family and then discover relationships and meaning there? Yeah. Before we get to the pathology part of it. And after that, I'll come to you, Dr. Gangadhar, and to Dr. Pradeep. Yeah.
As we know, this is very unusual experience everybody is facing. And in a room where 5 or 6 persons are staying, and everybody has a different connection with the wife, children, this and that. And sometimes their aggression, frustration, their boredom, that appears on the surface. Sometimes they behave very absurdly, sometimes they may be abusive, assaultive. So this time, one that is very important is awareness about why we all are in a lockdown situation. That is very important, and depend on the literacy status, so many other social and environmental factors. If anybody who is having, say, a specific personality type, definitely we should try to understand, and also we should try to understand emotions of others. And being a head of family person, he should behave very legitimately instead of children and the spouse. And they should make the balance, interact them, try to console them, understand them, give some, say, respite in this particular situation, and try to speak them, connect them, and try to understand why they are behaving like this. All these things will definitely show some kind of emotions that we can, if understanding each other, definitely we can handle them properly.
Professor Gangadhar, I mean, you had your hand up. I mean, how do you enable people to adjust when?
I'm aware of the concerns rise that what all we are discussing, and those who are logged on to Facebook is a different class of people, and those who need a different concerns to be addressed are a different class of people. I totally agree. In fact, I have had the opportunity to meet a couple of families, maybe more number of families, who are construction workers. Since everything is closed, they are living either in the construction hutments where they go and work and then come back, or some communal living where the building is nearly complete or half complete. In the same building, they're all living. Their concerns are totally different. I do admit that prescriptive methods won't work there. Their concerns have to be addressed. It could be as simple as getting food, which we did. We went and gave them some ration every week. Last 2 weeks I have done this. The concerns are, what happens if I become ill with this disease for which you're all fighting? Will I get help? How do I seek help? And then, of course, if the hospitals are all closed and the buses are not going, how do I move out to places if I need any help, even health-related help? And how long will this continue? How long will you be continuing to come and give us this ration? Is it going to be indefinite? These are the concerns that they have. And I think a lot of reassurance by going out, not necessarily on a digital platform, as far as possible physically, and some methodology using volunteers to reach out to these large numbers of population, whether they are workers or slum dwellers, etc., etc. Please remember, this is an extraordinary and unusual situation, but the reactions are all usual. So we need to address them, and there is no one reaction which is common to all. I don't think we should generalize the whole thing. There can be a lot of individual to individual differences, but nonetheless, at least as Nimesh mentioned, we need to think of two classes, those of us who have a different livelihood, living standards, and a big group of them who have a different expectations and living standards.
So, Dr. Pranjit, I mean, let me turn to you. You haven't spoken as yet. Are we saying at the end of nearly 40 minutes of conversation that these are extraordinary times, that people, when they find themselves in a situation which they have never ever experienced before, that there is a societal-wide heightened anxiety status? And if so, how are we going to deal with it, both at the biggest levels, and also how do we kind of do that at the individual level?
They are different for the population who are living in slums, who are living in two-bedroom apartments, who are living in bigger houses. Those who are predisposed, social isolation can aggravate their depressive feelings. Those who are living in slums where the daily needs are not met, and there are 7 children to be fed, and the ration is in short supply, the paramount stress goes up and up, in turns lead to a kind of helplessness in such subjects, which may predispose them to such kind of behavior. The other subjects who are drug addicts, the social isolation.
So we'll come to the specific cases a little bit later. We will. Right. We have to come there. We will come there. So let's come to Dr. Desai. I mean, we take two very big, broad things: confinement and then the anxiety part of it. I want to surface that.
In a sense, one might well say that in the early part of the 21st century, you have millennial human anxiety. As Dr. Gangadhar was saying, in the disaster mental health and conflict-ridden work, many of us have found this adage very useful, that any reaction in such situations is not to be seen as an abnormal reaction, but to be seen as a normal reaction to an extraordinarily abnormal situation. Now, we have spoken about that in disasters which are still smaller as compared to this pandemic. As you said, Bobby, I mean, this is a global human crisis, like everybody said, never seen, at least not since 1945, the end of the Second World War. The point is that, and yet what Prakriti and Roma were saying is crucial. Like Dr. Gangadhar was saying, we'll have to perhaps tailor our solutions and advice to different class groups as per their situation. What I want to flag here is Maslow's hierarchy. From safety to basic physiological needs to the other needs. And so all care workers, not just as health professionals and mental health care professionals, but all care workers, I suppose they are mostly doing that. We have been trying in Delhi to sensitize all care workers to the fact that the Maslow's hierarchy will operate. If all of us will remember what happened about 4 or 5 days into the lockdown, those huge groups of migrant labor moving out to the state borders in various parts was essentially the practical aspect of Maslow's hierarchy. And so the safety perception or the risk perception for self and the family, I think, needs to be even brought out more than it has been done in the media. I do think that the general media, especially audiovisual, needs to bring out a message that many of us recapitulated here. that if you are being confined to your place, however inconvenient it is, however annoying it is for your own benefit. So to repeat myself, the risk perception and the benefit that the individual will accrue from it. Because let's face it, at the end of the day, while I completely am with Sameer Parekh in about social responsibility being inculcated, at the end of the day, for individuals and families, especially parents of young kids, what matters is what about my kids' safety? What about my safety? And so, if we can through this seminar and spread a message more that the society and the media need to get more the benefit of this confinement as compared to the inconvenience.
Sure. So I'm going to take that last phrase that you kind of used, that there is potentially a benefit to this confinement, and unpacking that would be important. How do you kind of unpack it into situations where, let's face it, there is gross gender inequality. Husbands or the men of the house, they go out in the morning, they come back. The only time that they see their wife is when they are back, and it's in a particular role only. This is a completely different space. How do you enable that discovery? Dr. Deuri, let me start with you, and then I'll come back to the two ladies, and then come back to Dr. Indla.
Yeah, thank you. What I was trying to understand is this isolation or the confinement. This has two parts to it, built into it. One is the physicality of it. The physicality, like all of you have already discussed. This is something which has to be found during our journey, because it's not possible to give a prescription sitting here saying that when you have a one-room apartment where 8 people are sharing it, how do you maintain that physicality? So I think that some work will have to be done in that. So this mostly the individual will have to arrive at his own truth. That is one. Now the social and emotional intellectual part, that is another important thing. What happens is when you have uncertainty around you, you start thinking that you don't really have an answer. Nobody has it. So you can have individual reactions, you can have group reactions, you can have a community reaction. So what happens is when you have an individual reaction, it starts saying that, okay, I can be depressed, I can be anxious, I can go into panic attack, I can ultimately end up in suicide. That is the individual response. It depends on the predisposition of the individual, the predilection of the individual, and his propensity to act. These are the three things that will define his reaction to this whole situation. Now, the group, as a group, last few days we have already seen that the perception of the message which goes to a particular group or a group identity, when they are in a confined space, what happens is that perception is decoded by the group in different ways, which may not be same for everybody. So the reaction may be that we can have violence, we can have disruptions, we can have, say, some collective self-harm behavior. All these things can happen. But when again the same thing, the community gets it, that will be in a larger perspective. Then what happens is there can be fear, there can be panic, there can be suspicion about others, there can be behavior which is unexplainable, like hoarding and things like that. So my take in this whole thing is, when we talk about the fallout of the physical, the restrictiveness or that isolation or say quarantine, whatever we call it or want to call it, has two parts built in it. One is the physicality, which has to be addressed according to the requirement of a particular individual, which you are doing for telemedicine. The other is the individual. There's a prescription for everything. When you have an individual reacting in a certain way because of this situation, it will be just cared for in the same protocol.
Fair enough.
Only the social part. And that is something I think will require a lot of understanding and a lot of interaction with the community.
Sure. Dr. Roma.
So when you are, there are so many kinds of behaviors which you suddenly start seeing, which you were missing out while you were going to work and you will come back. A lot of couples would not even be, connecting with each other because of the hours of work. And when the husband and the wife meet up, that's for a little hours. So prior to this lockdown, what the relationship has been between them and what is the relationship now that is there with them. That's very, very important. If the relationship has been already in a very volatile state or very toxic, then this situation can either make it better or make it even worse. So we are hearing of all kinds of communication which has gone down, and some couples have actually built up that communication. So kind of couples who are coming in for counseling are actually building up on this communication with each other, and they're redefining, and they are also rebonding together and reconnecting, which is a very positive thing.
Prakriti?
Hi. We've had, of course, the distress line, so we won't get the positive cases coming in to us. We get a lot of the negative sort of cases and their points of view, and there are many. There are many people who've complained about alcoholism and the fact that there's been a complete withdrawal that's happened, like sudden cases later, so I won't get into the details of how that affects the entire ecosystem in the house. And we've had cases where, of course, the one-on-one couples wants to be able to make a difference, but the other party is still unwilling to have conversations about it. We've had children call about the fact that they want their parents to call the helpline, but the parents have isolated themselves in their room and have refused to come out on the phone. So there are relationships, and there are people who are living independently and have nobody there, and they're the most affected. So the young lot who've come out into the cities and are actually now working are so nervous about their parents back home, have no access to them, but have no access for themselves as well. And God forbid they're actually dealing with their own illness of some other kind. I mean, they have a complete breakdown that's taking place, and they don't even know where to reach somebody.
Right.
So that's...
Right. Thanks, Prakriti. Because what I want to now turn to is Dr. Indla, and to Dr. Rajiv Mehta. The thing is, we didn't have a great baseline to start with, right? If we starting with the assumption that all our houses were happy, unlike the way Leo Tolstoy started his book, there is unhappiness in every house, and it's different for each one of them. How do you build towards, or how do you kind of take this as a kind of a point from which to build on? How do you kind of address communications to a set of people who can pick up a phone, who know who to call, and to a large number who just don't know, and there is not enough resources there? And before you kind of answer, let me speak to the audience that we have on Facebook Live. Part of what IHW does is bring many experts or different points of view together. And part of my job is to kind of mix and match and push together a set of ideas or concepts that allow you to think. My job is not to drive towards a solution or get an agenda in place. My job is to make sure that we together are thinking about something that concerns all of us. And in this particular moment, 50 minutes into our conversation, many thanks to all our experts who are there from different parts of the country who are devoting their time to this Facebook Live. What I would like you to do, those of you who are listening to this and watching this, consider the points of view that are being placed and see what you can take and apply, whether if it's in your own familial situation, or whether it's somebody that you know, or whether it's somebody else that needs to hear some of the ideas that are being talked about. And together, that way we can spread. Because let's face it, we like doctors. We think of doctors as only one kind. If we think about mental health professionals, we have preconceived notions. Those need to go. And this is probably one of the best times to rebuild our idea of what mental health is. And in doing so, we will be able to then re-engage, and which is where I want to now start back with Dr. Indla. If our baseline of, let's put say, relations and harmony in our own selves and relationships, and also understanding of our mental well-being has been poor, how do we build further on? So you're on mute.
Bobby?
Yes, sir.
Am I audible?
Yes, sir. Go ahead.
Can you just tell the crisp of your question once again?
So I had summarized for the Facebook Live audience, but
please.
Just essentially asking you, so we know that this is for the first, let's put it this way, at this scale, we are confronting mental health for the first time. We all individually, we know at our community levels or at our practice levels, but at a large, broad scale, I think everybody is beginning to get a sense that we need to pay attention to what's inside of us, not just merely what happens with our bodies physiologically. And so therefore, how do we get that communication to across different levels, not just to the people who can log on to Facebook Live or call a helpline? There are many, many people who will have their difficulties but don't know where to get to. How do we get this communication? Because I know that every one of us has talked about communications, media, everything. How do you make it meaningful? Where do we start? Go ahead, sir.
Yeah, I think this is not a see, the building the communication. I think within the family it should come between the family members, husband, wife, and before that, about just a small example I want to give. Some of our employees who are working with us, usually they complain very frequently that there is a lot of domestic violence, especially the sons or the son-in-laws. They are alcoholics and they come and beat. Domestic violence was very high. Surprisingly, what I found now is the domestic violence has come down significantly because there is no. See, alcohol really stopped in most of the places. I think almost all the country. So domestic violence has definitely come down, and they are happy. And other thing, is definitely the human relations have become more. The humanity has become more. Like helping others. See the amount of donations that are pouring now. The amount of donations they are pouring down, and the food we are serving, the medicines we are giving, and going to the slums and helping, and all those things. So this is one aspect. But what you are telling is about the communication to build up between the people. This is a very good opportunity. Even if the people, husband and wife, not at loggerheads before, now probably it is a time for them. See, now the physical intimacy is much more in the house, and definitely it is a very good time for the wife or the husband to strengthen further relationships. And there are inhibitions because now everybody is anxious about the getting corona or what will happen to their lives and the children or the relatives like that. So probably this is a very right time for all the family members, or especially the husband and wife also, to see that life is very short. So whatever we are going to live, we should live a peaceful and happy life. So this is the time for us to strengthen our relationship or communication and try to have any negative feelings like that. And they should try to strengthen their bondage or communication or networking with their relatives or seeing the old albums. They should recollect their pleasurable times in the past and see their marriage album and see those times we were so happy, and also see their children's when they were born. So probably recollecting some past pleasant events and the memorable events in their past life, and probably that will strengthen their communication, and probably a bondage can be a positive bondage can be built. So this is a way of strengthening the relationship. And also they should realize that we don't know, life is very uncertain now for everybody. So in these uncertain times, and our mind is prepared for the certainty. Now it is very unpredicted, and people should not take it as a curse. It is an opportunity they should take it as an opportunity. It is not a curse. It is an opportunity to build the relationship, to strengthen the relationship. If there are misgivings, they should try to patch up those things and try to have a new relationship or strengthening the any negative bonds or whatever it is.
Thank you, Dr. Indla. I mean, what you're saying probably applies to 15% of the population, right? And I don't mean to be argumentative, but I've worked with HIV, and I used to kind of go and look at what is the opportunity cost of using a condom. I mean, when you had 5 minutes in a high flow space occupation area, I mean, the opportunity cost of 30 seconds of time that is taken over for the use of a condom was very, very difficult. And we managed to overcome that. So therefore, that notion of intimacy and things that may be problematic and may be challenged in the context of where we are at, because we are right now in a very, very different situation. So therefore, Dr. Rajiv Mehta, let me ask you this question. How do we kind of enable, your mic is on mute. How do we enable at a family level, at a couple level, at a interpersonal level, the let's put it, say, lesser of friction?
See, previously, I think you asked the question how to create a mass awareness regarding the mental health issues. Now you're talking about interpersonal things. So I need to answer both.
Yes, if you can come, right. Because you cannot go and talk to everybody individually. You'll have to come from the top down only right now.
Right.
At a broad level.
So basically, it is very right that mental health is the most important thing. Most of the diseases happen because of the stress. Everybody knows about that 80% of the medical illnesses are because of the stress. So But mental health has its own stigma, as you said earlier. They have wrong notions, everybody. And most of the person don't have resources and don't know what the mental health professional treats. So it is basically creating a mass awareness. The mass awareness can be created by the system who have a larger system in their hands, like media, like government agencies. Media is doing a wonderful thing by again and again picking out the mental health issues. Like every day there are mental health experts on the TVs. Like you are doing a Facebook live. Likewise, the print media is also printing about the mental health issues. Similarly, the government needs to tell that this can impact, like Prime Minister Modi told that we have to light up the diyas. Similarly, somebody from the government higher up needs to tell that this can impact your mental health and how the mental health is impacted. What are the signs and symptoms of the impacted mental health? And what are the ways out? What are the positive ways out? What are the negative ways out? See, if I am having a panic, I go and have a drink. Or if I am having a panic, I go and consult a doctor. Where are the doctors available? Where are the other mental health professionals available? So that can be created only by the uh, authorities who have large system in their hand. Media definitely contributes to this, and the other NGOs also definitely contribute to this. This is like telling a baby that when you are hungry, you don't eat a chow mein. You have better ways to satisfy your hunger. So when you are anxious or depressed, don't do the negative things like go into the drug addiction, but you have better ways available with the mental health professionals. That is one part. The other part is interpersonal relationship. See, we have a term called expressed emotions in psychiatric. We have to understand that the relationships, whether it is employer employee, whether it is parents children, whether it is spouse, the relationship where there is lot of hostility. Hostility means abusing verbal and physical. Even silent treatment is a kind of hostility, where there is a lot of concern and over pampering, where there is a lot of criticism and directiveness, suggesting, leg pulling, teasing, mocking, and most importantly, communicating in a why form, like a memorandum. Why have you done this? Why have you done this? Why have you not done this? That means picking up the fault and then demanding an explanation. So all these kind of communications are negative type of communications. We have two things while communicating. The first one is intent, what we wish to convey. The second thing is approach. Suppose if I have to ask water from my boy, I can ask, please give me water. Can you bring me water? I am very thirsty. So the same intention is conveyed in different forms. So many a times the intentions are not wrong. Many a times the intentions are very good, but the approach, if it is done in the wrong way, like criticism, directness, directly ordering advices, then it hampers the relationship regularly. Being perfectionist at home in the personal relationship also hampers the relationship negatively. So they have to be conveyed in a better form. Praise is the basic fertilizer of any relationship. So try to find out the right kind of things at home. The easiest way to praise is just to observe and just to tell. It doesn't need a very big thing to praise. And the second thing is to ask the person whether he or she is willing to do the things. Like, can you place it there? Can you switch off the TV? So there are better ways of communication.
Sure, sure. So, I mean, I want to kind of, because, Dr. Desai, before I come to you, because I see Professor Gangadhar sitting in front of a board, which I recognize and I kind of respect a lot. I mean, the Echo platform that you have, that Nimhans runs. I just want to kind of turn to you and ask you this question. We're saying that people need to be sensitized, people need to be taught. We're trying to co-opt the media. Those opportunities are lesser. We need larger numbers of people who are, let's put it this way, engaged and trained. I believe that you have a tool there that is essentially for the, let's put it, the more qualified or the professional ones. But is there a way that we can enable many more people to, in the very short run, it's like an emergency kind of recruitment? Can we have more people be, let's put it this way, equipped to provide some kind of help in the communities where they are?
Just 2 days down the line, Nimesh is launching a short training program for all psychologists. I'm not talking of clinical psychologists, all who have had a education in psychology at the level of MA. The numbers are staggering, a huge number available in the community. The moment we gave this notice, close to 1,000 people have already given an application to go through this very, very brief training, which is about 2 hours training as to how to educate, de-stress people in the community. Having said this, I also want to say that we, with the help of Dr. Deori in the Jaipur and also Dr. Ram in CIP Ranchi, we have launched the helpline, and we have also had a brief training for people, and this has been going on very well. But what is important is, I think we should recognize that the needs of different groups of people are very, very different. Just about an hour ago, I made a small document and a video clipping, which hopefully our institute will host it. There are about 3 million students whose entrance exams have been now postponed. Aspirants for higher positions. Their needs and their concerns would be totally different in a stage of this lockout, uncertainty when the exam will happen, etc., etc. There are a host of people, young mothers who have just delivered a few days ago. There are many other concerns they have been calling us. There are people who are in elderly homes who have called us for different reasons. So I think there are different groups of people, like Dr. Nimesh was saying, we could classify them into 2 large groups of those who have different living standards, X and Y. But there could be in different living standards and different groups of people, there could be several needs which are widely different across groups of people. I think it is important, as you said, we need to immediately create a host of well-being volunteers who could reach out to different groups of people, and in a very, very short time, by the time we wake up, prepare the syllabus, train them, hopefully the lockdown would be over. And this, like you said, is a totally unprecedented situation which has taken the entire health machinery off guard. I think let's see how we will rise up to that. And this is the reason why I think the health ministry is making an appeal to the public to rise to the occasion and help out how to reduce the spread of this infection.
Right. I mean, this is also a classic case where out of sight is out of mind kind of a thing. Many things about mental health, because it's not so visible, people kind of don't pay attention to it. It's also kind of physically here. Because Dr. Pankaj Gupta's video was off, I mean, his was off the screen for me. I didn't even realize that he was raising hands and I couldn't even see. And so my deepest apologies to you, Dr. Pankaj from IIHMR Jaipur. Let me kind of ask you the same question, the way I've kind of posed it to Professor Gangadhar. Is there a way that we can, given the enormous amounts of need, get larger numbers of people trained and in both culturally or contextually and with the right kind of skills? I mean, how is it that we can kind of actually address this need?
I think, Bobby, you have asked the right question to me. And
I know you're the dean of IIHMR, so I know you're a training institution.
Yeah, we are the top university in the area of healthcare, and we have been in the healthcare research and health management for the last 35 years.
Sure.
We were set up in collaboration with the Johns Hopkins. So you see that there are 2 situations here. One is that the basic training, which is easy to do. But the kind of problem which we are facing right now is, people are having a very, very, very quick fuse. And as we saw in different part of the India, that when certain people were there and then a little bit of misbehavior or something, then how the situation became very much flared up. And therefore, the basic idea of really understanding it as a crisis situation, or still to keep your mind cool. One is that what somebody was sharing, that having a drink and chill out. So one is that finding solution in outside world or finding it in the inside world. When we train our students, we train them for both and try to make a holistic development in that way. And so it is very, very important that I think some author also said that the best of the time are the worst of the time, and the worst of the time are the best of the time. So there are many people in the panel also have shared that there are a lot of positive impact. There are a lot of, the deepening of the relationships and many things. But it all depends in our own mind, whether we take it as something which has been imposed on us. And also the credibility of leadership also plays a very important role. Because if somebody feel that someone like PM Modi is leader of only the majority or Hindus, and therefore why should we listen to him or something like that. So that also sometimes make a very, very important thing. So when you develop people and when you develop the resource, even we have been advising the Rajasthan government. We are part of two very important committees. Our chairman is part of both the committees. And so I believe that it is very much important to develop this kind of human resource. We already are part of the effort on the national disaster management and relief work. So a lot of people of the health workers and CMOs who were trained by us in handling the disaster, they are now guiding different states that how this situation can be managed. And I'd be happy to share more. I have some more very, very important points to share with you.
And I'll come back to that. I mean, sorry for having kind of not seen you before, but I think it might be, you might be a force multiplier for the curriculums that NIMHANS and IHBAS and the other institutes are putting together. It might be a good way to kind of transition it from in the specialist audience to a more broader audience. And I'm mindful of the hands that I'm seeing right now.
So we have been very much doing many mental health conferences where NIMHANS was also a partner. We have Dr. Vimal Sharma and many other very distinguished people with us. So maybe I will share more details. Okay, thank you.
So I just have a speaking order. I just want to kind of first get Dr. Sameer Malhotra, then come back to the others. I mean, where you've been listening, because after your first intervention, you've been listening. What sense are you getting of the conversation right now in terms of how do we enable the behavior at home, both with the self and with one's most immediate relationships? How do we kind of enable, let's put it, a better environment?
I think you've put the right question in perspective, and I've been listening to all the speakers so far. What I can make sense and what is really very, very important is that this is a very good time for a person to internalize and understand where he or she stands with respect to his own life goals, lifestyles. It is a time to reset one's priorities in life and perhaps to build relationships within the family network. So it's a very good time to bond. Now, the message which has to be created across the spectrum of the society that we are talking about, whether we are talking about laborers, whether we are talking about people who are staying in big bungalows, it should cut across, and that has to go through, perhaps one approach could be through mass media. When we talk about
let me stop you there for a second. Let me stop you. Has there been enough of that kind of a message, or is it something that we need to start right now?
I think we need to start. The message has been more or less more on the physical aspect of the illness. The message on the mind health perspective is somewhat going amiss. So when we are talking about, say, I'm talking about little clippings of videos where we perhaps pick on what Dr. Rajiv Mehta also spoke about, perhaps about expressed emotions, how the same thing can be converted into something which is disgraceful, and the same thing which appeases the other person and helps in building relationship. It could be a very small 1 or 2 minute video which could be played. And I'm sure even the poorest of people in India do have access to some form of a media, whether it is through radio, whether it is through television, and through perhaps national news channels.
Or through WhatsApp.
Yeah, absolutely. Now, coming to the other aspect was about division of labor. So if we could have small clippings of videos where we show division of labor, where a male is also helping the female in household chores, perhaps those kind of clippings. And if those kind of clippings come through, I mean, the message has to be loud, it has to be clear, it has to be simple for even a lay person to understand. And perhaps if celebrities, if sports persons, if psychiatrists, doctors, they come across with this kind of a message, perhaps it will be more amplified, visible, it will be more understandable to the general population. So the approach here would matter, how we get across in simple terms rather than making it too complex.
Sure, thank you. So which kind of a very easy punt to Prakriti, because I have seen your WhatsApp messages that come along that have been kind of very, very creatively done. How do you kind of enable that to a larger audience? Because you're sending it probably, I mean, what's the size reach? How do we kind of then make it more ubiquitous and understandable to other people?
So at the moment, like we're talking about training and development for simple things, we've started to use the Albert Ellis model, and we've trained like over 500 of these volunteers that have come up. And the reason they've come is actually because of these social media posts that we put out, where we're reaching out to them saying, listen, come in, we've all got a purpose in our heart, and if you've got any experience, come in. So they've actually managed to come in, they flow in quite easily. And then the training program, because we're talking about how do you actually scale up and teach people with some kind of background in this. So we've got the YMCA and Rotary Club aligned with us, of course. So Rotary Club District 3141, which means all of Maharashtra aligned with us. And we managed to get people of relevant backgrounds to learn these simple basic skills of the ABCDE model. So really teaching them just, what the activating behavior and activating event cannot be changed, nor can the consequence of how do you change that belief system in the middle. So all of these things that we're talking about, whether it be changing of behavior, is a change of belief system. And so these sort of people that we've trained have the ability to do that. And I think that one of the things I always harp on is stop making mental health so difficult for people to comprehend. It is so simple, and we want to make sure that it's a dynamic, it's age appropriate, it's for the youth, it's for the adults and senior citizens. We want to democratize mental health, and that is why posts do that. It's about well-being, and I think Dr. Gangadhar actually used the word well-being, and that is the key thing, because whenever I'm talking about even insurance, because the foundation does a lot of work on trying to make sure mental health can be insured. Mental health cannot be insured because we don't have enough practitioners. And if we actually do build the capability of people who are the first line of defense, and then we scale it up to actually the professionals, the doctors, etc., I think we have a solid foundation where India can be a forerunner when it comes to mental health, because we have given the whole world peace and we've given the whole world meditation.
Yeah, I like your positivity on this, Prakriti, and more power to you. But I remember, earlier in the conversation, Dr. Solanki and both Dr. Parekh Singh both had mentioned specifics in terms of, one was addiction behavior, the other was alcohol, and then how it can kind of amplify or pressure cook in our situations. And before I go to them, I just want to kind of have Dr. Desai come in a slight pivot and just say, look, we understand that we have a broad, unprecedented situation. We understand that people need to look inwards. They need to kind of get a sense of what are they, what's the meaning, what's the purpose, how are they comfortable with themselves, within their relationships. But let's face it, people also have difficulties. They have difficulties with either self-esteem, or they have difficulties with depression, or they have difficulties in how they relate with their spouse or children or parents, addictions. How do we kind of get into those kind of situations, especially let's put it this way, in a pressure cooker kind of a situation now?
I like the pressure cooker, and that's wonderful. But I'll come to that in a minute. And before I come to your specifics, can I just carry on from what Prakriti was saying? Yes. I'm entirely with her positivism, especially about, and as you said earlier, the whole issue of mental health being redefined, not just for the society and for all of us as citizens, but also for the policymakers and the government. Maybe we'll come back to that a little later, but every syllable that Prakriti said. I also want to go back to what you had said. I'm reminded of what Tolstoy had said about families. In Anna Karenina, Tolstoy said, and I quote, I think correctly, all happy families are happy in similar manner. All unhappy families are unhappy in different ways. In their own ways. And so it's very important to realize what many people have been saying through mass media, through people like you. We need to get across those small messages of building relationships, building positivity in the society, and all of what has been said. The other issue that I want to come to, Bobby, is also what you mentioned about you having worked in HIV. There are two examples that I can think of where there's a very good simile for us to now get to the masses. The concept of passive risk. In HIV, a great help was done by the passive risk advocacy, much more so in smoking. as Dr. Pankaj Gupta will remember. So we need to get across that if I am asked to confine myself or behave myself in a certain manner, that's not only for my own health, as I said, but also passive risk to the others. And so that social pressure needs to be built for behavior modification. To come to specifics, depression, alcohol, and other drug dependence, indeed all chronic mental illnesses which are on treatment or under services. These is all disaster and conflict situations and epidemic situations. This has been established very well. One of the tallest orders for the mental health systems is the recurrence and relapse of those who were already on treatment. This happens, one, because of the stress of the situation. Second, the discontinuity in treatment. So, all the hundreds of people who are with us, our audience, I just want to say that I'm very aware that not only in Delhi that we have been trying, but many states and cities, government mental health institutions, psychiatry associations, groups of mental health professionals, and individual psychiatrists have actually made different ways of telemedicine available. So the first job for families of persons with mental illness is to ensure that there is no break in treatment. Indeed, I will go beyond mental health disorders to all neuropsychiatric disorders, possibly all chronic diseases. But just like chronic mental illnesses, epilepsy is another major casualty when it comes to such situations. So the continued and to ensure that the long-term treatment is continued, and by now avenues are available. In line with that, telecounseling. I, for one, will perhaps, while supporting Dr. Gangadhar and Prakriti in their efforts, and we would all want to do that, and we keep doing that, I do still believe that although we are a transitional society, there are a lot of inherent strengths in our own small communities. So while semi-formal training is a great idea, I think we need to catalyze through again mass media how we can help each other. Those trained volunteers actually can come from the community in their own. Many disaster situations we have seen that enough number of times. So while doing the formal training or the semi-formal training, we need to perhaps encourage that brand of that group of people who are willing to be the good Samaritans. But to say it one more time, Bobby, this is the time for the country, definitely, perhaps for the world, but certainly Afro-Asia, to redefine mental health at concept level, at implementation, and at policy level.
Right, and that's a very good point that I will kind of want to use in my summary. That there's an opportunity here, but let me kind of turn to Dr. Solanki and to Dr. Pranjit Singh. I mean, in the specifics, I mean, and then Dr. Desai has kind of labeled out a few. I mean, in terms of both people who have been battling with it and or kind of been on treatment, there is a chronicity there, whether it is depressive illnesses or whether it is in terms of addiction or whether it's in terms of helping cope with violence and towards self or towards others. What is it that you would want to kind of see happen right now, given that we say that, let's put it this way, you can go out of your house for emergency medical care. Now, emergency medical care means you've got a broken leg, right? But you don't know what's happening inside the mind. How do we kind of get that? How do you kind of address it? I know that Kerala has tried to do some home visit that both of you are seeing there. So let me first.
Yes, I think as Dr. Desai has mentioned, first, I mean, those who are under our follow-up patient, many of patients we are receiving phone calls, and just because they are not getting their regular medicine, so some of them relapse. And as authority and Rajasthan Medical Council, they have authorized us to use WhatsApp and other social media to write down the prescription. But as a psychiatrist, we should always be careful about the civil acts drug and NDPS. Besides that, lot of phone calls are also we are receiving about so those who are having our number or number of our faculty, and either their parents or patients themselves they are complaining about their sleep disturbances, then irritability, then some behavioral problems, then sometimes they become hostile, abusive, etc. And so now some of them are feeling bored and depressed, and because of this they feel loss of touch with the reality, concentration issues, and some other issues. And in most of the follow-up patients, which just because of this Rajasthan Medical Council's appeal, we have started telemedicine, and we have also started, giving some counseling to our follow-up patient. And as far as concern about this new patient, those who are nearby any psychiatrist, if they can reach, then definitely they should go for consultation personally. And even at psychiatric centers, services, either OPD or indoor services, are still continued, though number of patients is reduced drastically. And as far as addiction is concerned, which is really very difficult, those patients, especially in the alcohol addiction, if they are facing, say, emergency situation, we advise them to seek admission and consult in an emergency. Otherwise, we usually motivate them, and just to, because of this behavioral modification, they just moderate this withdrawal symptoms. And beside their, internal motivation and some other behavioral modification, we try to manage them.
Dr. Paramjeet, specifically, I want to kind of ask you, for those that are, let's put it, say, on the depressive side and on long-term treatment, and those that are prone towards self-harm, what is it? Because those are literally emergencies. They are life and death situations. How is it that we are able to, or what is it that we can do, and how is it that we can equip the community? And this is where I'll then come back to Professor Gangadhar and Dr. Indla in terms of where we kind of enable these emergency services. They may not be able to come to the hospital. We need to probably meet them closer to where they are at. How do we go? Dr. Paramjeet.
Yes, you have rightly said. This is an emergency. In such situations, we must associate ourselves. The mental hospital setup and the general hospital psychiatry. We have trained many medical officers all over the state for the National Mental Health Training Program, where we have addressed adequately how to handle people who are in this tricky situation. So they can go there and they can get themselves treated. They are at the taluka level, at the tehsil level, and at the district hospital setting. Number two, we must get involved with the NGOs working in the mental health section, who are working in the field of mental health. They can get in touch. They have to outreach them, and they can find out the subjects, and they can refer them for the treatment. These issues are to be addressed. If we don't address, it has global implications for the family and society as a whole. Such messages can be delivered through media, so the larger population can act upon them.
Right, sir. Professor Gangadhar.
Come to the main question that you said, how to reach out these people. I entirely agree that mental health has to be democratized and it should not be professionalized. And even mental illness, for that matter, should be professionalized, but need not necessarily be so specialized as we are doing it right now. It should reach out to people through the general practitioners, and mental health should be a public health domain where people are talking about how to be well and a well-being agenda. Having said this, I'll come back to this issue of mentally ill who are in the community. How are they facing this issue? I would strongly feel that all the people who have mental illnesses, who have to receive their medicines, should reach out to the nearest general practitioner or a public health dispensary and see whether this is possible. I am hoping that all states will again rise up to the occasion and make sure that these medicines are available. Number one. Number two, the general practitioner should be able to either continue or help them out with these medicines through, if required, telemedicine services which are available. In fact, NIMANS has set up a telemedicine center. It has been going on even before this crisis happened. But having this seen this crisis, we are gearing up to a different level of functioning, and we are hoping that this will become successful. And those who have been followed up at NIMANS, we have offered a service actually. And those who are receiving just merely free drugs, We are using all the peripheral public health systems to make sure that these drugs are delivered to them on our tele-prescription. But the fact remains, like I said, no one system is the perfect system, because this was something that came up very unexpectedly. And I always keep telling all my colleagues that this has been a crisis with a lot of challenges. Let's use all these challenges as a possible opportunity to convert a better health system for our people.
At a certain level, we need to let go of the notion that mental health is a set of people who will handle it when it becomes unhandleable, if that's a word, at the home level. It has to become, like Professor Gangadhar said, more democratized. Mental health cannot be the domain of mental health NGOs. I think it was Dr. Solanki you were saying, or Dr. Parekh you were saying, that let's engage with the mental health NGOs. It need not be just it should be everybody. Anybody who's got any business in health and well-being of the community need to have a component, or need to have a higher sensitivity towards the mental health needs of the community. Because if people are not in a state of well-being in their minds, the social engagements are also largely impacted. And so therefore, figuring that out is also an opportunity at this moment that we need to work towards, given that such a situation has been, let's put it so, foisted on us. How do we move forward? And more specifically, we started off with the notion of confinement, quarantine, and let's put it this way, isolation of individuals, to try and figure out how people were coping with it. Let's take one more specific thing. We've talked about people, husbands, wives, or the gender relationship. What happens in between generations? Children with parents, parents with children. It works both ways. Our houses have got adult, older parents also sitting with us. Perhaps we haven't spent as much time with them since we started working, or the other way around. We haven't spent as much time with our children, at least those of us that are men, haven't spent time with our children at all. It's been, let's put say, offshored to our, or devolved to our wives. How does that happen? And then I want to start with Dr. Roma here. Those relationships there.
Yeah, so parenting is something, as it is, very difficult. Nobody teaches us parenting. So when parenting comes to such a situation, I think everybody's hairs are apart. All young parents are finding it really difficult to deal with children, and children themselves are a package by themselves. So as a parent, I think this is a time to connect with children, and we are getting calls where the mother is saying, no, I just don't want to do it. I'm done. I can't do beyond that. My nanny is not there. Nobody's there to take care. I can't do so much of work. So my question is that when we have children, is it that we have children so that somebody else can take care of my children? Or is it my responsibility to take care of my child? That's a question that I put forth. And also, as parents, I think we need to now come to a situation where let's build up their resilience. Let's make them understand what is happening. And for times to come, we have to build up and we have to help them deal with high frustration tolerance, not being able to go out, and what does that mean to them? And of course, their adaptability levels. So the tolerance can be in many forms, like the high distress they are feeling. They're not able to talk to friends, they're not able to go play, they're not able to do many things. But there are so many things within the house itself. If the parent is wanting to decide to do with children, can definitely be dealt with and also taken care of within the household chores. And coming to the fact that we ourselves who have got our parents staying with us, I think it's time to connect with them. Because what we've forgotten is to even sit down and even have a little bit of a chai with them, and just have a meal with them, or connect with them and just have a small gup session. I think this is the time that we should all just get out of our discomfort zones and just connect with each other.
Which kind of gets me to the question, and then I want to kind of go to Dr. Indla first. The messaging that's coming through as far as this corona pandemic is concerned is this: that people who are older, people who have comorbidities, are more at risk, right? When you're at a home, when you are now in a confined space, when your children that you have so lovingly brought up and have you made them into whatever they are today aren't really talking to you, and you have your own anxieties right now, because the constant messaging is you're at risk. How do you even begin that conversation? I know that Dr. Roma says, discover your parents, have a gun, but how do you even address the anxieties that are there of a set of people who also see themselves in a very vulnerable position right now? How do you even provide some kind of a support? I want to start with you, Dr. Indla.
Yeah. See, I think we should first put one very, very practical point. See, all of us might have faced some stress in our life, like individual stress, like death of some close relative or some financial loss or whatever it is. So when the individual stress comes to any one of us, definitely we are very much upset or unhappy or depressed. Now, what we are facing is universal stress. It is not confined to one individual. It is a universal, not India, not the entire globe is affected. So when the something is becomes more generalized or universal, definitely the intensity of stress, we should make this point to everybody that it is not your personal loss, your personal problem, personal unhappiness, personal tragedy. So all of us are undergoing the same situation. So probably when we generalize it, definitely the stress levels will come down. I think this point we should put people who are becoming more suicidal or desperate or something, anxious or worried. So that point should be highlighted to all the people. And when it comes to the children, as you said previously, she was telling, see, I just tell my grandson who is 9 years old, who is very fond of chicken biryani every time. So now when I was telling day before yesterday, he said he is very conscious. No, grandpa, no chicken biryani, no chicken may be contaminated, so we don't want this. So children are becoming more conscious. I think I was surprised being a small kid who is very fond of chicken, and now he says that he is aware that this is not the time. We don't. It may be contaminated. It may be something, whatever it is like that. So we should not underestimate our children. They are more conscious. Only our job is to educate them properly, the plus and minus, not becoming more anxious in front of them, put them the realities to them, and such things like that. And also, the previous thing you were asking about the social things, I should tell them when somebody is very desperate and depressed like that, it is not permanent. Maybe in another 1 or 2 months, the entire problem may be solved. So, like the summer or winter, which comes and goes, probably these problems are also permanent. It comes and goes. So, just let us be prepared for this crisis. And anyway, this has taught us a very good opportunity to develop more tolerance, overcome upset, unhappiness, frustration. Probably this is what nature or God has given this. See, this is a testing time for you, that you should become more how to cope up with this stress, unprecedented stress. Probably in our lifespan, we may not get this type of situation in future at all. Probably this is the worst of worst. So what more? So once you probably become immune to this, probably you can face any type of stress in future. So this type of message we should give to our children or to the our own clients who are coming to us for counseling or whatever it is. So if you put this type of positive message, I'm telling others, I just want to share some. Siri, one minute I'll take. See, recently we have seen in our Andhra print media, the dogs are becoming more violent nowadays because there is no food for them on the streets. So you're telling that whether they are suicidal or they become violent. See the animals, the street dogs which were getting some food here and there, now they don't have any food on the streets because even the humans are not having food. So the dogs are becoming very violent because there is no food. They can't get any food on the streets. So they are biting. More dog bites are reported recently in Andhra Pradesh and Telangana. This is the reason they have said. Another thing, in Hyderabad, where the monkeys, where they get this prasadam of the Lord and people is going, and there is no prasadam, no coconut chips and all these things, they are becoming and biting. So that means when the animals are becoming like that, probably we should also be prepared. The humans, the deprived people who are not getting food, they become a little more violent in course of time. So I think we wish that this situation should end at the earliest.
Yeah, that's I don't know how to take that, whether as an analogy or whether as a metaphor, but whatever.
No, it is a fact. It is a fact.
So the problem is this, that we are in, so let's put it this way, a situation where we need to figure out how we don't bite each other. Okay, let me kind of put it that way. That's what I would take. And then if you have to prevent people from biting each other, there are two things to it. I know that we have talked about the word demographic dividend as far as young people are concerned. At this point in time, especially for the world of mental health, especially in a high anxiety situation, is it time to discover a demographic redividend? And by which I mean, there are a lot of older people with the wisdom of years with them who could be speaking sanity into the communities. I know that earlier we kind of talked about it's not possible for our health systems to reach everywhere. We need to get the community systems. I think it was Dr. Gangadhar who was talking about it. Can we figure out a way that we have our older parents who are able to be able to become a part of this whole mental health healing initiative? Dr. Desai, I want to start with you and then come to Dr. Pankaj Gupta on this.
Sure. I think that sounds like a
very,
that sounds like a very good idea. Utilizing the younger population as a dividend, the elder population as a redividend, for sure. And formally or semi-formally, as we said. But can I also flag something else? We are still talking about a majority of the society that lives with families. Please don't forget, there are people who live alone. There are people who live in hostels and in very difficult circumstances. There are people who live as single couples, elderly single people or elderly couples. And so it seems that what we are saying in last few minutes, at least, if not an hour or more, is besides mental health, the formal and the semi-formal aspects, focus on mindfulness about oneself, but more importantly, focus on relationship issues and social support. Somewhere we'll have to, as I think Prakriti was saying, and I'm really so much with her energetic positivism, we need to, as a society, rediscover, Bobby, the relationship aspects that we have had traditionally. In the westernized, globalized 21st century existence, that's really ebbing. I wouldn't say it's over, but it's ebbing. And so focusing on relationships, like Sameer Malhotra was saying, maybe through mass media campaigns. But the positive aspects of, in fact, I'm very fond of saying for last 2 weeks that I'm very uncomfortable with this concept of social distancing. I would like to see it as physical distancing. I would want to say maintain physical distance, but increase emotional.
Yes.
Yes.
And so not only at the micro level or individuals and families, but as a society, as a nation, we need to, perhaps this is an opportunity to rediscover also those traditional aspects.
Right. And I'll come back to that because that's part of my tail end part of it. Let me kind of just very quickly ask Dr. Pankaj Gupta, because you're the one that kind of also thinks in terms of how to deliver large-scale skilling and training programs. Is there a way that we had just now talked about, get to our older parents and people who are living and then fill them with a sense of both purpose and utilize the wisdom that they have acquired over the years in becoming a healing or a soothing balm for the mental health issues? How do you do that?
Okay, for me, nobody is old actually. Age is only a number, and therefore this very belief that somebody is old and they can do this and they can't do this is all again only a stereotype. And I have seen that when these people are getting to play with their grandchildren, there is a different level of bonding they feel. And of late, there has been some research and somebody has been sharing that it is not very proper to, grandfather to play with the grandchildren and this and that. A lot of those things were there. But I have seen a lot of positive side of it. And also I have seen, if you look at the example of Japan, that certain thing like washing the hand, going down to each other, and generally having a system of cleanliness and all that has been a part of the whole culture.
Right.
And therefore you see that there is a very less impact of corona over there.
Right.
But we have been doing so much about the negative messaging that if you don't do this, then this will happen and all. But I believe that there has to be, even on the WhatsApp and other thing, also the way when we handle with the SARS and all, we had shared that this family did so and so positive thing, so therefore they are beyond this COVID.
Sure.
So I believe that kind of messaging also we have to think about. Secondly, if you think about the messaging for the rural and for the urban, there is a very, very big difference in the two messaging. And earlier we were thinking to submit a proposal for the government of Rajasthan. We were discussing about it. Like earlier there was a big problem in the Bhilwara and also in Junjunu district. So we saw that we discussed internally with all the faculty members who are very research active. So we thought that if we give a very clear messages, short messages in Marwari, and that would be very, very effective. And we did those kind of experiments. So about the elderly people, what they're looking at, is more of an acceptance and unconditional love, and not getting a feeling like a old furniture which is no longer being used. So the basic thing is, that I believe that a person like us, we should always feel so grateful, that our own bodies are because of them. And that itself is a very, very big thing. And that is what virtue we have to also tell our children. Because no matter whatever parenting we do, the values are caught, they are not taught. So what my son will look at my behavior, and not whatever I tell him, you do this and you do that, it will not make any impact. My unconditional love, my going and, touching their feet in a real sense, not in that way just to show off. So I believe this we can do at the same time, maintaining a very good calculated distance from them, getting them feeling of being wanted. And I believe expanding the whole concept of self, that everything is not the I, me, myself, my family. And, moving from I to we, because I leads to illness and we leads wellness.
Thank you. Therefore, that's a very helpful way of kind of looking at I, illness, and W to
wellness. So what I will just add one more small thing I'd like to add here. The whole system of mental health also need to think about, who you are as a possibility and how you are looking at your own expansion in the whole world. So one small virus has made us feel that man should not have the desire of being the boss of the nature, but being a part of the nature. So that is also I'd like to share with you. Thank you.
Right. So therefore, then I have there are questions from the Facebook Live audience also. A couple of them that I've kind of bundled together. I've tried to weave them into the conversation too. But there are two specific ones that I want. Let me start with Dr. Deuri. You can kind of pick this up. There's a very, very specific one. There are overworked healthcare professionals right now. They are, if I've called this entire situation a pressure cooker, they are in, let's put it as a subset of it, incredibly near the fire end of it. How do we meet their mental health needs? Is there a way that we are kind of able to do so? Dr. Deuri.
Yeah, I think this is something which I was seeing it coming. These are definitely challenging times. These are uncertain times. But I get a feeling this is also going to pass after some time. But what is happening at the moment is we are stretched to the limits because of resources. What you have said is, it's a fact. When people are there in a confined space, in a pressure cooker situation, the needs are higher because they don't have any other avenue of adapting themselves or getting an outlet of their inner feelings or whatever you call it. So what happens is, in such a situation, we have already been talking about using digital platform for getting more, recruiting more manpower and upscaling provision. But my feeling is, even among ourselves, three things are very important. Communication is the key. One is information, one is misinformation, other one is disinformation. Information is, if there is not adequate information, even among professionals, or not appropriate information is transacted, that causes harm. Disinformation is purposefully distorting information for achieving a particular purpose. That is also equally harmful. That's, I think, the journalism is something which has been a known exercise in the past. Now, coming back to the disinformation is, you distort an information which is available in the open space because you perceive it wrongly or it was presented in a wrong way. If these three things are taken care of, our job becomes easy, because the collective community wisdom has to be taken into consideration. That is what is the most important part.
Sure. Right.
For some time, we have been talking about how do we, I'll give you a small example, and I'm mostly addressing to the other group of people who are looking at us in the Facebook.
Sure.
What happens is, we have been talking about the finite space, physical space, with infinite amount of problems there because of physicality, because of, say, social, intellectual, emotional issues, or whatever. What happens in such a situation? It is not always easy to give you a ready-made solution to that. That's not easy. So what will happen is, over a period of time, you will have to fall back into your collective wisdom or the cultural wisdom which you have, and that has to be recruited to overcome this situation. That is one. Among ourselves, all the mental health professionals, for that matter, will have to have a network to fall back upon and to have consultation lies in which, because many situations will arise, because it's very difficult to predict human behavior or any other issues related to this. So it will be easier that way to communicate and try to mitigate the issue, whatever comes into being. Now, again, addressing to the...
I'm mindful of time too, because we're kind of also running short on this one. Just as to kind of point to Dr. Desai, you had raised your hand. Yes.
Can I quickly add that the National Indian Medical Association, IMA, is actually considering a tele-counseling helpline for doctors and healthcare professionals. In the next few days, that will roll out. So the concern that that member of the audience raised is very real, very necessary. Healthcare professionals, including doctors who are under stress of being the providers at the front end. I'm lucky to be coordinating that. And so this week, that IMA helpline for telecounseling of health professionals should roll out. So just watch out for IMA. Yeah.
Sure. Same thing. I mean, there's another question, which was the larger one. The first one was a very specific one, which was towards the healthcare professionals. But there's another question that says about all employees, all companies, all employees, because they're also trying to deal with it. And all companies may not have internal HR professionals who have got those capabilities. Is there something that is similarly available? Is it from, say, that same platform, or is it something like what Prakriti might be doing?
Can I?
Yes, sir.
I happen to know from Delhi and from all over the country, like I had said earlier, there is a range of helpline services already being offered. Information helplines for those who seek information, as Devi was saying, correct information. Telecounseling helplines for general population who might just want to clarify and seek some support. Telephone helpline services for those who are registered clients and they want treatment continuity. So there is a range of helplines being offered. There's always a possibility of duplication and overlap, but I guess that's all right. You know, the more the merrier. Let 1,000 flowers bloom. We need more.
We need more. I mean, Prakriti, I mean, from your side, I mean, from as a more like an NGO kind of a thing, what is it that you can kind of do to scale up what's being offered from the IMA or the other services that are being offered here?
So like the doctor said, I believe in the collective spirit. And I think that if everybody comes together on one platform, we'll have that much, a much more robust platform. In fact, for a lot of these organizations, we're actually white labeling our services as well, so that they can promote it with their employees, and the employees just backward integrate their call center number into ours, and we can help them. So it's a very non-egotistical approach without any name. It's very it's very neutral. Sure. And that's really what we want to do. We just want to be able to give people what they require.
Right. Dr. Sameer, I mean, a lot of this conversation has been, let's put it this way, institutions which are in the, let's put it this way, public sector. The private sector tends to get a little bit of a rap in terms of what they do in broader general public health kind of a thing. How do you see, say, the Maxes, the Fortises, and then hospitals like where a large number of health professionals will be at, how do they engage and how do they kind of address this big need?
See, they've already raised platforms to help people in distress. We are already providing online consultations and counselings. Patients who have already been enrolled with us in the past are in touch with us. New patients are getting enrolled, and there is an online consultation process which is also inbuilt. So we are also getting geared to this technology, and we are trying to use this technology to the advantage of many. At the same time, we are also developing certain services and also planning certain surveys so that we are able to tap what exactly people are going through at this point of time. And I'm sure IPS is also putting an effort in that direction, where we are able to tap the initial reactions of people, what they are going through at a ground reality level, so that we are able to modify our treatment protocols to reach them. We are developing special counseling systems in place so that people can reach out. And we are catering to different category of people there. So one would be for people who are perhaps being quarantined, family members of those who are either quarantined or in hospital. We are talking about healthcare professionals and family members of healthcare professionals. And healthcare professionals also the ones who are frontline and the ones who are being quarantined. So there are different subcategories, and we are devising programs to reach out to all those people who are vulnerable at this point of time. I think
Thank
this
you,
is
Dr. Sameer.
to step out of our boundaries, or whether we are working in a private or a public domain, or a government agency or a non-government organization, to step together to help humanity as a cause at this point of time.
Thank you so much. I mean, that last bit, I mean, that we have to step beyond our, let's put it this way, work boundaries, or the way places where we find ourselves normally 9 to 5 in another world, and kind of enable a larger number of people to be reached with this services and help that they so desperately require. And this might be an opportunity, say, for institutions like IIHMR. And I know that Dr. Gangadhar had also kind of pointed out that there may be training sessions that would be rolled out. The IMA one that's been there. And then for those of you that are kind of watching this over Facebook Live, tune into any one of these, or since you've seen and heard the people that are there, that have been there for the last nearly 116 minutes on counting, and I've got 4 minutes to close. Reach out to them and engage with them, because here are people with the resources, with the institutional backups, who will be able to provide you with either the wisdom or direct on help, or point you to the resources where help might be obtainable from. It's been a fantastic last nearly 2 hours. Part of my job is to both provoke the conversation and ask questions in such a way that the conversation kind of both moves on and it enables us to collectively think. Part of it is also not to give questions to our panelists in advance, because then you get answers that are already prepared. But and with psychiatrists, or with people who are working in the world of mental health, I don't think words are in short supply. We do get them, and it's been such an absolute pleasure. I want to sum up. We are in unprecedented times. Never has the world been closed up like this as now. We are being confined, whether we like the word or not, whether we think that we are being penalized or not. We are being confined by and are at the mercy of how a virus moves across humanity. We've had astonishing progresses in science over the last 100 years that gives us the confidence that sooner than later, we will be able to confine the virus and enable ourselves to get out. But in this time, as we have heard from our panelists and experts here, we have the opportunity of looking within ourselves. What is this time that we have been given, so that we understand both purpose and what we need to do with our relationships? If we have difficulties, asking for help is not admission of failure. Ask for help, and there will be somebody at the end of some phone line or in your community or somewhere who will be able to lend an ear. If you are somebody who is reasonably confident of yourself, please do make it a point to lend somebody a ear. You have two. Keep one for yourself, lend the other one to somebody else, and listen to them. They may have something, when shared, reduces their burden and allows them to continue on for that day. And in doing so, you may begin to help them in their process of healing and of their walking to a better well-being status for themselves. There are helplines, there are channels, there are initiatives. But be also mindful that we are not only grappling with a coronavirus epidemic, we are also grappling with a misinformation epidemic at the same time. Be careful with what you're consuming. Not every message is helpful for you. And in fact, too much of a good thing can also be a problem. So figure out how much you want to take and what you want to take. And be mindful that once you take it in yourself, to apply an adequate filter. Do not allow what is coming into through your eyes and ears to come out of your mouth unfiltered. Do not hit the forward button on your WhatsApp or your social media accounts irresponsibly. That causes more harm than good. We are at the point of the pain of repetition. We are in unprecedented times. When we emerge from this, and we shall overcome, we should be sure that we are not coming out in a state of trauma. We didn't use the word, but I worry that at the end of 21 days, at the end of the next few months, at the end of this epoch, we might collectively emerge with a state of traumatic stress disorder, not at an individual level, but at a humanity level. And we will have to figure how we cope with that. That will be our journey together. That will be our journey of shouldering each other, enabling each other, and helping each other to be seeing the brighter side of life. Thank you all, professors, doctors, friends, for being with us the last 2 hours. It's been an absolute privilege of shepherding this conversation, and I have learned much. And I hope that those of you whose faces I can't see, who have been on Facebook Live, I hope that you have benefited as much, and that you would take actions to make sure that somebody in your vicinity, in your home, in your neighborhood, in your community, or within the nation is helped simply because you lent them a helping hand and lent them a ear to listen to. Thank you so much. It's been an absolute pleasure.